Hey everyone, it's Dr. Mike, and today we're talking about a topic that's incredibly important for your heart attacks. Recognizing the signs early can be the difference between life and death. In this video, we're going to cover 15 signs of a heart attack you should never ignore. So whether you're health conscious or just want to be more informed, this video is for you. Let's start with the most well-known symptom, chest pain. It's the most common sign and often feels like a heavy pressure, squeezing, fullness, or a painful ache in the chest. This pain typically occurs in the center or left side of the chest and can last and go in waves. Don't wait to see if it goes away. Call 911 right away. Imagine this. You're struggling to catch your breath, feeling like you've just run a marathon, even though you've barely moved. This feeling of breathlessness can occur with or without chest pain, and is often described as a feeling of tightness in the chest. It's your body's way of signaling that your heart isn't pumping blood effectively. If you experience sudden shortness of breath, call 911 immediately. Nausea and vomiting might sound like a common stomach bug, but they can also be signs of a heart attack. During a heart attack, decreased blood flow and oxygen to the digestive system can lead to these symptoms. If you're experiencing nausea or vomiting along with other unusual symptoms, particularly chest pain or shortness of breath, seek immediate medical attention. Pay attention to your body and recognize when something doesn't feel right. Pain that travels, arm, neck, jaw, or back. When we think of heart attack pain, we often imagine it as a sharp, intense pain in the chest. However, the reality is that heart attack pain can manifest in various parts of the body, making it harder to recognize. Heart attack pain can radiate to other areas of the body, most commonly the left arm. This is because the heart and the left arm share the same nerve pathways, causing the pain to travel. This radiating pain happens because the nerves that branch out from your heart and those that run to your arm, neck, jaw, and back send signals along the same pathways to your brain. The brain can sometimes get confused and misinterpret the source of the pain, leading to discomfort in these other areas. So, your brain can sometimes misinterpret the location of the pain. This phenomenon is known as referred pain. It's crucial to understand that pain in the arm, neck, jaw, or back could be a sign of a heart attack, even if the chest pain is not severe or noticeable. Don't dismiss pain in these areas, especially if you have other heart attack symptoms. Symptoms like shortness of breath, sweating, nausea, or lightheadedness, combined with pain in these regions, should prompt immediate medical attention. Early recognition and treatment can save lives, so always err on the side of caution and seek help if you experience these symptoms. Breaking out in a cold sweat, a chilling sign. Imagine this. You're suddenly drenched in a cold sweat, even though you're not hot or haven't been exercising. During a heart attack, your body goes into fight or flight mode, releasing adrenaline, which can trigger excessive sweating. This type of sweat is often cold and clammy. If you experience sudden, unexplained cold sweats, seek medical attention immediately. Unusual fatigue, when your body's sending warning signals. Constantly feeling exhausted, even after a good night's sleep, can be a subtle but significant sign of a heart attack. This type of fatigue is different from the tiredness you feel after a long day or a sleepless night. It's persistent and doesn't go away with rest. When your heart isn't pumping blood effectively, your body has to work harder to compensate, leaving you feeling drained. This inefficiency can lead to a buildup of fatigue that seems unexplainable. Your heart is a powerful muscle, and when it's not functioning properly, every part of your body feels the impact. If you're experiencing unusual fatigue, especially if it's accompanied by other symptoms like shortness of breath, chest pain, or dizziness, seek medical advice. These could be early warning signs of a heart condition that needs immediate attention. It's crucial to listen to your body and not ignore these signals. Don't brush it off as just being tired. It could be your body's way of warning you about a potential heart problem. Early detection and treatment can make a significant difference in your health outcomes. Always prioritize your well-being and consult a healthcare professional if you notice persistent, unusual fatigue. Feeling dizzy? It could be more than just dehydration. When dizziness strikes out of the blue or is accompanied by other unusual symptoms, it could be a sign of a heart attack. During a heart attack, your heart struggles to pump blood effectively, leading to a drop in blood pressure. This sudden decrease in blood flow to the brain can cause you to feel lightheaded, dizzy, or even faint. If you experience sudden, unexplained dizziness, seek immediate medical attention. Heart racing? When to worry about palpitations? Heart palpitations can be a warning sign of a heart attack, especially when accompanied by other symptoms. During a heart attack, the heart's electrical system can be disrupted, leading to a rapid, slow, or irregular heartbeat. Occasional palpitations are common and often harmless, but persistent or recurring palpitations require medical attention. If they're accompanied by other heart attack symptoms, get checked out by a doctor. Indigestion or heartburn. More than just a spicy meal. During a heart attack, the pain signals from your heart can sometimes be misinterpreted by your brain as coming from your digestive system. If you experience sudden, unexplained indigestion or heartburn, especially if it's severe or accompanied by other heart attack symptoms, seek medical attention immediately. Don't dismiss it as just a simple case of indigestion. Swelling, a sign your heart needs help. Swelling, also known as edema, can be a sign of heart failure, which can occur during or after a heart attack. When your heart isn't pumping efficiently, it can't circulate blood properly, causing fluid retention in your lower extremities. Sudden or unexplained swelling, especially if it's accompanied by other heart attack symptoms, requires immediate medical attention. Anxiety's grip. When worry becomes a warning sign. During a heart attack, your body releases a surge of adrenaline, triggering feelings of intense anxiety, fear, or a sense of impending doom. This anxiety might be accompanied by physical symptoms like a racing heart, shortness of breath, dizziness, or chest pain. If you experience sudden, unexplained anxiety, especially if it's severe or accompanied by other heart attack symptoms, seek medical attention immediately. Don't ignore these feelings. They could be a warning sign. Coughing and wheezing, a sign. Your heart needs attention. A persistent cough or wheezing, especially when lying down or at night, can be a sign of heart problems, including a heart attack. When your heart isn't pumping efficiently, fluid can build up in your lungs, causing you to cough or wheeze. If you notice a sudden change in your cough or experience new wheezing, seek medical attention immediately. Imagine this. You're going about your day, maybe running errands or enjoying a walk in the park, and suddenly everything goes black. You feel a sudden dizziness, and before you know it, you're on the ground, unconscious. This sudden loss of consciousness, also known as fainting or syncope, is a serious medical emergency that requires immediate attention. It can happen to anyone, anywhere, and at any time, making it crucial to know how to respond effectively. During a heart attack, your heart struggles to pump blood effectively, leading to a drop in blood pressure and a decrease in blood flow to the brain. This can cause you to faint, as the brain is deprived of the oxygen it needs to function properly. If you witness someone fainting, check their pulse and breathing immediately. Ensure they are lying flat on their back and elevate their legs to help restore blood flow to the brain. This can be a critical first step in stabilizing their condition. Even if they regain consciousness quickly, seek medical attention to determine the cause. Fainting can be a symptom of a more serious underlying condition, such as a heart problem or neurological issue that needs to be addressed by a healthcare professional. Always err on the side of caution and get them checked out. Unexplained weakness. When your body feels drained. Sudden, unexplained weakness can be a warning sign of a heart attack, especially if it's accompanied by other symptoms. During a heart attack, your heart struggles to pump blood effectively, leading to a decrease in oxygen-rich blood, reaching your muscles and organs. If you experience sudden, unexplained weakness, seek immediate medical attention. Persistent sleep disturbances, like difficulty falling asleep or waking up frequently, can be a sign of underlying heart problems. Research shows a strong correlation between sleep disturbances and an increased risk of heart disease. Sleep deprivation can disrupt your body's natural hormone balance, leading to increased inflammation and higher blood pressure. If you experience persistent sleep disturbances, talk to your doctor. So, there you have it. 15 signs of a heart attack you should never ignore. Recognizing these signs early and seeking immediate medical attention can be the difference between life and death. Share this video with your loved ones, spread awareness about heart attack symptoms, and let's work together to save lives. Remember, knowledge is power, and being informed could make all the difference. ##